Assalamu alaikum wa rahmatullahi wa barakatuh. Hi everyone, this is Ibrahim Alyami. Today we're going to talk about our paper with the name or with the title Mining Patient Reviews in Online Health Communities for Adverse Drug Reaction Detection of Antiepileptic Drugs. The authors of the papers are Dr. Anwar Ali Yahya, Dr. Yousef Asiri, and Mr. Ibrahim Alyami. We are working at the College of Computer Science and Information Systems at Najran University in Saudi Arabia. Before we start our presentation, we would like to thank the organizer of this event for giving us this opportunity to talk and to share the knowledge with great minds in the world of computer science. So today we're going to have an introduction and we're going to talk about our study, data mining and pharmacovigilance, methodology, results, validation, conclusion, and future work. In pharmacology, drug safety, as known as pharmacovigilance, is of particular concern. Why? Because it helps to approve new medication and to answer questions of withdrawing a drug from the market. The detection of adverse drug reactions, ADRs, is really an important task in pharmacovigilance. Why? Because statistics and studies shows that 7,000 out of 100,000 of medical errors causing death in the United States in 2000 are due to adverse drug reaction. Approximately 5.3% of hospital admissions were associated with adverse drug reaction. Antiepileptic drugs is a group of drugs that is used to treat epilepsy. They are actually associated with serious ADRs that cause mortality, morbidity, increase the economic burden, and loss of productive time. Because of the importance of pharmacovigilance, our paper will present a data mining based method to detect ADRs of anti-epileptic drugs from patient reviews collected from online health community. A list of ranked ADRs for each AEDs is generated and validated against drugs that come database. The results, we will show the result later on this presentation, show the validity and the utility of using patient reviews in online health communities as a source of adverse drug reaction detection. Data mining has gained an important role in pharmacovigilance and for adverse drug reaction detection in particular. And data mining, as we all know, that it has 4 types of data sources. It has spontaneous reporting system, electronic health records, pharmaceutical database, and biomedical literature. Social media in these days has been used by patients to write their reviews, write the side effects of drugs, communicate with other people that have the same health issues. Therefore, social media has emerged as a promising data source for adverse drug reaction detection. And actually, data mining for adverse drug reaction detection from social media is in its infancy. So that's why we need more research to investigate its validity and utility. We have 4 stages in our methodology. We have the first stage, raw data collection, the next stage, data pre-processing, ADR extraction, AEDs, and ADR's correlation measuring. The first stage, raw data collection, we collected number of reviews that we will show next slide from askavation.com. In this stage, we use a Python library called Beautiful Soup to collect and to scrape the patient reviews from askavation.com. And the next stage, which is data pre-processing, the data actually, the raw data has composed of free text. So we needed to text to pre-process the reviews. So we used natural language toolkit library in Python to text cleaning, text normalization, remove stop words, and anagram generation. This is the second stage. The third stage, ADR extraction. In this stage, actually, we have to match every anagram term with an ADR lexicon. However, the internet is known by its casualness and openness. The patients might use different vocabularies from professionals' vocabularies to express health concepts. Therefore, the straightforward matching here will not be a good solution. To deal with this problem, we used consumer health vocabulary, or known as CHV, to convert each term into its equivalent medical term. After mapping the anagram terms to their equivalent CHV terms, we map the terms into ADR lexicon to identify the ADRs. Now, for this purpose, actually, we used ADR lexicon compiled by Diego Lab. It's a lab that is in Arizona State University. So let's move to the final stage, which is AEDs and ADRs correlation measuring. In this stage, we use the proportional reporting ratio, or known as PRR. It's a statistic that is used to summarize the extent to which a particular adverse event is reported for individuals taking a specific drugs, compared to the frequency at which the same adverse event is reported for patients taking some other drugs. So here we have a matrix containing the list of AEDs as a columns and the list of ADRs as rows. Each cell in the matrix contains the frequency of a particular ADR to measure the correlation between each AED and ADR. So in this slide, actually, you can see the list of reviews that we scraped from askapatient.com. In the left side, actually, we have around 13 drugs, and the number of reviews range from 1,845 reviews to 100 to 79 reviews. On the right side, you can see the top 10 detected ADRs for each anti-epileptic drugs. As you can see, the PRR value here represent the strength of the correlation between drug and its adverse drug reaction. Where the higher the PRR values, the stronger the relation or the correlation between the drug and the drug adverse drug reaction. Actually, some of the detected ADRs require immediate medical attention, while others, such as loss of weight and weakness, doesn't need that immediate attention. Also, there are like some drugs here that have common adverse drug reaction, like maybe they share like 5 or 6 the same adverse drug reaction. In order to evaluate the validity of the proposed method, we used drugs.com as a gold standard to provide the list of documented ADRs for each anti-epileptic drugs. The top K recall is adapted to measure the validity of the ADRs detection. It is defined as the proportion of the documented drugs.com's ADRs in the list of top K detected ADRs. The table on the right shows the top K recall for each adverse drug reaction, where K equal to 10, 20, 30, and 40 in the last column. Conclusion and future work. This paper presents a data mining approach to detect the adverse drug reaction of a specific set of drugs, especially anti-epileptic drugs. So the main conclusion that can be drawn from the obtained results is the validity of the proposed approach, which is PRR, for the detection of anti-epileptic drugs adverse drug reaction from askapatient.com. Several insights on the similarity between anti-epileptic drugs in terms of adverse drug reaction have been also drawn. In future, actually, we will focus on developing a new metric for measuring the association between the anti-epileptic drugs and adverse drug reaction. This is it for our presentation today. Thanks for your listening. And any questions?